Okay, everyone, we're about to get started since it's the top of the hour. I want to thank everyone for joining us for the webinar on the Behavioral Health Communications Toolkit. The webinar today is being recorded and will be posted on our website. We will send out the recording and the slides to all participants once it is posted to the website. I am Ambrisha Johnson-George, a program specialist with the National Rural Health Resource Center, which is providing the webinar today. Please connect your video feature by selecting the camera icon in the lower left corner of your screen. Your audio is muted by default to avoid background noise and feedback. Please remain muted unless you have a question. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you dialed in, press *6 to unmute your line. You can also communicate through the chat box, which is located on the bottom ribbon of the middle of your screen. And if you haven't done so already, please take a moment to type your name, title, and organization in the chat box so we know who is joining us today. This will help us get a good feel of who the audience is during the webinar. So the National Rural Health Resource Center is a nonprofit organization that is dedicated to sustaining and improving healthcare in rural communities. The center is the nation's leading technical assistance and knowledge center in rural health. The center has served rural hospitals, clinics, and other providers nationwide for over 25 years and has partnered with the Federal Office of Rural Health Policy for nearly 25 years and collaborated with the Delta Region Authority for nearly 15 years to assist rural providers and communities with healthcare needs. The Delta Region Community Health Systems Development Program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Region Authority. So the center is committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is valued. You may learn more about our commitment on our website. Okay, so we have a few polling questions, which should pop up on your screen now. The first one is, I am blank in my understanding of what communication tools are available at no charge to assist in communicating my organization's educational opportunities and services for behavioral health. The second one states, I am blank in my understanding of the logistics of customizing testimonial videos and other deliverables. I'm going to give you a few moments to answer those questions. And as you're doing so, please plan to join us for the upcoming telehealth webinar series. On March 16th, we'll be discussing remote patient monitoring. And on March 23rd, we will be looking at telehealth for older adults. Okay, so during today's webinar, the Behavioral Health Communications Toolkit, we will share materials that focus on stopping the stigma associated with mental health and starting a conversation about behavioral health. Amy Yaeger, Senior VP of Client Services at Epic Strategies, will share the components of the Behavioral Health Toolkit developed on behalf of the center. It's my pleasure to introduce today's presenter, Amy Yaeger. Amy is the Senior Vice President of Client Services Healthcare Division for Legato Healthcare Marketing, a division of Epic Strategies. She has a bachelor's degree in marketing and a master's degree in administration in education. As a former marketing director and clinic director for the Midwest Rural Clinic Access Hospital, Amy's experienced in all facets of marketing, community relations, and strategic planning. She led the opening of a patient-centered medical home clinic and has received accolades by the Wisconsin Healthcare Marketing and Public Relations Society, ASTOR Awards, and more. She was recognized as a Rural Health Ambassador by the Rural Wisconsin Health Cooperative. The oldest of 8 children, Amy is a natural leader and connector, bringing the right stakeholders together to achieve goals. Amy, I'm now turning the presentation over to you.
All right. Thank you so much, Ambrisha. Can you all see my screen okay?
Yes.
All right. So I'm so excited to bring this all to you. We started this conversation last fall and really relied on the feedback of this group. So I'm super excited to present all the things that we've been working on with Ambrisha and her team over the last few months. So you got my bio. It's always hard to hear stuff about yourself. So thank you for that, Ambrisha. Today, we're going to talk about all of the components of the communications toolkit and exactly what went into the campaign messaging, what is in the toolkit itself, and that last important section about the video stories and how to do those if you want to customize your own. So as we all know, mental health is at the top of the needs of so many communities, especially in rural, and we've got some key statistics here for you. It is definitely a bigger problem in rural areas, especially with access to care. So we sat down as a group and talked about, let's just get folks to talk about this and share some resources with them, and how is the best way to communicate those resources with them. So we've got a great toolkit for you all today to share some of the ways that they can get more resource information, start the conversation about their behavioral health with their family or community. And so also some other resources that are available to them for free and confidentially. So the center has been working on this with us over the last few months. And as Ambricia shared, our main goal was to try and help remove that stigma in rural communities and start talking about it. We conducted a survey last year to really get a better grip on what was being offered in the community, what were some pain points in regards to behavioral health. And we looked at the resources that were available, any challenges, what were some of the most prevalent behavioral health issues in your communities that we could direct the content towards. And diversity we knew was going to be a key component, as we are so diverse in our country and in rural areas. And we wanted them to be able to see themselves in the content that we were delivering. So I think you'll see that in this toolkit as we go through that information, the help that is available to them. As we know, there are resources available to them, but they may not know it. We know that the 988 number kicked off last year, and people are still unaware of what that is, even let alone what that number might be. So we definitely wanted that to be one of our calls to action. And then also giving you all a stepping stone to be able to share any local resources on a website page within your website, and just giving you the groundwork to get that started and to be able to share that information within your community. The toolkit templates that are available to you are many. So we have the 6 print ads that address certain behavioral health issues that may be occurring in your community, and the posters that can also be printed and shared within your community that tie directly to those print ads. We have an educational flyer that kind of just brings it all together, the 6 different ads. We've got social media post copy and the graphics that can accompany with that. We have a radio script and an actual radio ad that you could use within your community today. We have website landing page copy for you. We did reach out to the Mental Health America group for some of that landing page copy that we can also share specifically to screening tools that we'll talk about today. We have a handout card that can be used within the community by anyone in your community, any of those key stakeholders that you work with in your community and within your facility that could be shared with anyone going through a mental health crisis. And we have a general video that can be shared and a way to make that customizable for you all. So let's get started on the actual templates that are within the toolkit. So the first thing that we'll talk about are the print ads and the posters. So we started this and we were thinking there was just going to be one concept. We knew that after our survey that we needed to make it more related to the different behavioral health issues. There's a lot to talk about with each of those key issues. So we created 6 different concepts regarding the different topics like anxiety, depression, etc. So we'll show you the samples now. So we've got the print ads that start with depression. So our headlines, you'll know these tie directly to the other content that you will see within the toolkit. And I'm not going to read all of the copy to you for each one of these, but let me just share with you the depression one so you get a feel for what the print ads will encompass, because we try to develop copy specific to each behavioral health issue. So in this one, it says, depression is a darkness that few can navigate alone. There's strength in understanding that you need help to find your way back to the light. Mental illnesses are common, real, and require treatment like any other health condition. If you are having thoughts of suicide or experiencing a mental health crisis, you are not alone. Stop the stigma, start the conversation. You'll see that headline throughout our entire toolkit. And then we've left a placeholder for you to customize these PDFs where you can enter your name of your organization, the key phone number that you want your folks to be going to in a behavioral health crisis. And then obviously that amenity health placeholder where you can throw in your logo. And then at the very bottom in that bar, it says for 24/7 confidential support, call, text, or chat 988. So each of the print ads and posters will have this similar feel and address the different issues. So our first topic was depression. Teen mental health also rose to the top in our survey. So we wanted to address that and specifically use language towards self-harm, anxiety, and depression among the things that teens are addressing. And again, following that same layout at the bottom with our headline of Stop the Stigma, Start the Conversation, the placeholder for the logos, and your name of your organization, and a key URL or website address that you want to put in there as well. The next topic that we chose based off of the survey was addiction. And as you'll see, we used different age groups, we used different genders, we used different races for all of this, as we know diversity was very important from that survey as well. So we have, when it's more than just a night out, for the addiction and addressing drug or alcohol substance use disorders that they may be addressing. Our next topic was post-traumatic stress disorder, easy for me to say. In this paragraph, we just say trauma can leave behind wounds you cannot see, and then follow along the same lines of that this is real, this is common, it might need treatment, and just stopping that stigma and starting the conversation again with that one. Anxiety was the next one that we addressed, and this one with the headline, when it's not just all in your head. And the opening paragraph of this one says, if you are overwhelmed with thoughts you cannot control, you are not alone. And that you are not alone language you'll see throughout our entire toolkit. Postpartum depression, we knew was an issue as well. So we addressed that with when it's more than just the baby blues, and address that with some soft tones as well. And again, the placeholders for your organization's information. So those are the 6 different print ads and posters that you can print for your organization and customize. The next part of the toolkit is the flyer. This is where we melded all of those ads into one that can be hung, whether it may be a bathroom stall within local establishments within your community, just one place where we can explain what 988 specifically is, getting a little bit more into that. So that's the differentiation with this particular toolkit item versus the posters. And just, we use the same graphics from the print ads that we were using, as you saw before. But again, the main differentiator here is really explaining the 988, as we know that there's still some confusion or lack of general awareness regarding the 988 number. The next component of the toolkit is your social media copy and the infographics. These follow right along with the 6 print ads and posters that you saw earlier. And this is just an example of one of them, but I'll share all 6 with you. So we've got the same exact topics. We have the copy that correlates directly with keywords that might be associated with anxiety or depression, postpartum depression, the teen mental health. All of that copy is there for you in a Word document that will be shared within the toolkit, already designed for you, that you can accompany with each one of these graphics. So these tie directly to the posters and print ads that you saw. So just a feel for those. And then this white box is where you can place your icon for your organization. So all 6 components there. All right. The radio ad is a radio ad that we produced. We worked hard to get a speaker who was clear, and I think it does a really great job of explaining what we're trying to get through in the print ads. So we'll give a listen to that right now. Let me know if you can't hear that.
When it's more than just a bad day, or a phase, or a night out, mental illnesses are common. Post-traumatic stress is real. Addiction needs care. As with any other serious health condition, you are not alone. Talking is the first step to taking back your health. Stop the stigma and start the conversation. For 24/7 confidential support, call, text, or chat 988.
We wanted to provide a radio that you could use from the hit the ground running today for your organization. There is a radio script for you that you could follow along and obviously customize for your individual organizations as well. So 2 really great toolkit items there for you. Landing page copy. We know that writing web page copy is so important in sharing our information. And with all of Google's algorithms and being able, if someone is having a mental health crisis, being able to develop content that hits those keywords that people within your communities may be looking for at the time of a crisis. So we worked on those keywords and established some links specifically to the Mental Health America's free mental health screening tools. They have several, not just the 6 that we've addressed, but this might be the first screening tool that they'll ever see specifically for something that they might think that they have. So we worked really close with the awesome people at Mental Health America to be able to share this for free. Anyone can do it. It's completely confidential, and the results might awaken them to, wow, I might need to talk to somebody about this. So we have that link for you there. And this, I didn't share all of the copy in this little screenshot, but that Word document is also out there for you to just go ahead and copy and paste that right into your CMS or website content management system, where you'll be able to slip that right in. We marked the place for headlines so you can match that formatting directly to your website's headline copy and your subhead, whatever formatting you've got there. We've signified that with subhead and then laid out that language for you for keywords that people are looking for specifically in regards to behavioral health. The business card, for lack of a better term, the business card is literally a card, business card size, that anyone in your community, any stakeholders, social workers, police officers, teachers, this could be customized to any, not just your organization, but any organization within your community, really. But obviously we could customize that to your organization with your key URL website of the landing copy that I just shared, where you can list out local resources that you would really want to highlight within your community. But obviously all that beginning information that we just shared on the previous screen, and then your organization's logo can slip right into that business card template that you can create for your organization. These could be printed in-house. They could be printed with a professional printer. So we've made that option available to you for that. And again, this can be shared with anyone in your community. When I was the marketing director for our hospital, we had an entire group, a stakeholder group that met in regards to behavioral health. So we had our school principals that were on that group, the school social workers, public health involvement, local clergy, that they could hand that out in a mental health crisis to anybody who might appear at their door, police officers that would hand it out at a domestic violence dispute that they've been called to, for example. So really a great tool, just trying to get more of this 988 confidential place where people can find information and get the help they need. The last component is our video preview component. We've been working on this video over the last few months. It's about 1 minute in its current state. There is room for you to place a customized testimonial or patient story of a local community member who might be willing to share these stories. We know that there is high stigma associated with mental health and getting that story shared. So we also wanted to provide an option that you could use, again, hit the ground running with this. It's a general video that you could run that's about 1 minute long. You could put it on your website. You could run it on social media. It'll be in an MP4 format for you to be able to share across all of those. And you'll be able to share this at a community function, for example. So we've got a couple of different options for you. So we'll share that video preview. It's still a work in progress. We will have the final video out for you, but we wanted to share with you our start to it today. And then obviously, how do we customize that will be how we wrap up our conversation about the video today. So the customizable video portion is where you would capture a local mental health story. You would submit that video segment to the center, and the center can edit and place that video in the video that you're about to see, right in the middle, and then our call to action at the end, that is also customizable, where you can enter your information with your organization and your call to action for your specific website, phone numbers, etc. So we'll share the video preview with you, where we will have this, like I said, final and out on the web to you. And again, you can work with the center to customize what you're about to see.
When it's more than just a bad day, or a phase, or a night out. Mental illnesses are common. Post-traumatic stress is real. Addiction needs care. Just like any other serious health condition, you are not alone. Asking for help is the first step to taking back your health and your life. Stop the stigma. Start the conversation. For 24/7 confidential support, call, text, or chat 988.
We feature the awesome bumper at the end with the Resource Center new logo. It turned out great. But as you can see in that video, we really wanted to target a diverse group from ages, genders, races, as we shared before, and really highlighting those same headlines that they're going to be seeing in your print ads or posters, flyers, etc. There is a section in the middle where you'll be able to add that testimonial, and we'll work with the center to make sure that customized video portion will get in there. But how do you do that? What does that look like? We also wanted to cue you and just give you some hints on what to do in prep of gathering your story on your end. So for the customized video, we really want you to just ask these general questions and let them talk. Record from the beginning to the end. Don't stop in between. Just let this interview roll. What is your mental health story? What things do you feel you can control? How do you cope with your mental health? What brings you joy? What advice do you have for someone who may be going through this? So we would ask those key questions, and obviously you can certainly add other questions, but we thought these would be a good starting point for you all to ask and to record that whole interview, and that would be what we could edit at the center. So just some ideas for the video prompts there that can help you really get a good story going with the person that you might be interviewing. Obviously, you will need to get a consent form that your organization would use to be able to share that story. Don't forget that step as well. All right. So where do you find this toolkit? We have the link here, and Ambricia will obviously be sharing this after this webinar as well, but we want to share the URL with you so you can easily find all of the components to the toolkit today. And then we wanted to leave the last part of this webinar open for any questions that you might have logistically on customization, any more background that you might need on the development of the tools, and just any general thoughts that you might have in general with the toolkit.
Well, I definitely want to thank Amy for her participation in this webinar, your hard work in getting everything customized for this toolkit. And I do want to show everybody how to find this information on the website. So if you all go to our website, ruralcenter.org, you will come to our main page. So if you go to the very top and click programs, you will scroll down to the Delta Region Community Health Systems Development Program and push Explore DRCHSD. Once you make it here, you will go down to Customizable Communication Toolkit. Click that, and you will see all of our current toolkits. Behavioral Health Campaign is right at the top, and this is where you can find all of that information. We will have the video posted on our website by next Friday, so be on the lookout for that. Do we have any additional questions? Okay, well, I want to thank everybody for your time today, and you all have a nice rest of your day.
Thank you, everyone.
Thanks, everyone.
Thank you.